What's going on, guys? Tony Maritato here. I am in Home Depot and I want to talk about some of the grab bars and other assisted devices they have here that you might want to consider looking at before you have your total knee replacement. So I'm going to flip the phone around and I'm going to go through a couple of things. So probably the number one absolute best thing that I've seen in a long time are these elevated commode seats with the sidebars. Certainly there's bedside commodes and other things, but something like this, depending on the size of your body, depending on the toilet, and if it can be fitted and attached securely, this is an amazing option that I'm actually going to recommend for one of my patients right now. It's a lifesaver. He was stuck on the toilet not too long ago, and this is something that can prevent that. Now, when we're looking at grab bars and assistive devices, we have these suction cup bars right here. Now, while I may never recommend something like this to use on a wall, these work phenomenal on the countertop. So they essentially would go on the countertop like that. If I'm stuck in a seat, I can grab them to pull myself up. They work really, really well. For something more stable, something more permanent, we've got these decorative grab bars. And the main thing to keep in mind with these is how small the handle is. So for a smaller person with less grip, something like that might be great. While as conversely, there's the more traditional grab bar here that's got a much bigger handle, bigger grip. The main thing you're going to want to consider with these grab bars is the orientation. So they have these large kind of circles that need to be fastened by a professional. But when you're thinking about the orientation, are you going to have a grab bar run vertical? Are you going to have a diagonal? Are you going to have it horizontal? If somebody doesn't have adequate wrist mobility, elbow mobility, you have to find the position that they're going to grab most naturally. Now, quite often, there's transitions going in and out of the doorway. And so these skinnier grab bars with a smaller fastening, I don't know, whatever you call it, they tend to work really well vertically inside the doorway, whether it's a sliding glass door or something of that nature. So the main thing here is come to this area, look through some of the equipment. You know, like here's another one that's really helpful. It's a secured bathtub rail so that you have something to grab onto when you're getting in and out of the tub. Obviously, there's a bathtub chair that you can use to slide across in and out of the tub. This is going to be a lot safer for somebody who has poor single limb support. But there's something at every level. And so the goal for you, the goal for your plan before you have surgery is to have as much of this stuff in place as you can. Now, there are therapists, occupational therapists and physical therapists who specialize in this kind of advising. You can meet with them online. You can schedule a telehealth session. It may or may not be covered by your insurance plan, but they can make amazing recommendations for you without ever coming to your house. You can literally just take your phone, walk around, show them your setup, talk to them, and they can do an amazing job. So if you want to connect with one of them, I'll put some resources in the video description below. Otherwise, guys, the more you plan, the better your outcome is going to be. Thanks so much. I'll catch you next time.